Hello everyone, I'm Vanessa Mantilia, physical therapy intern from Arter Medical Foundation in Tacloban City. And for today's video, we're going to be talking about Addison's disease. Addison's disease is a rare endocrine disorder that occurs when the adrenal gland is unable to produce enough of the hormone cortisol and in some cases the hormone aldosterone. The adrenal glands are small glands located on top of each kidney. These are responsible for making different hormones including the steroid hormone cortisol and aldosterone, while cortisol belongs to a class of hormone called glucocorticoid. Cortisol helps the body respond to stressful situations including stress of illness, injury, or surgery. On the other hand, aldosterone belongs to a class of hormone called mineralocorticoids. These help maintain blood pressure and water and salt balance in the body by helping the kidney with sodium retention and potassium excretion. When the adrenal gland produces insufficient aldosterone, the kidneys are not able to regulate salt and water balance, affecting blood volume and blood pressure. This condition is also called adrenal insufficiency that occurs in both men and women equally and in all age groups. While in some cases, Addison's disease can be life-threatening. Now for its causes. Two major classifications exist for Addison's disease: primary adrenal insufficiency and secondary adrenal insufficiency. Primary adrenal insufficiency is caused by severe damage to the cortex or the outer layer of the adrenal gland that they can no longer produce enough hormone. This commonly results from an attack on the adrenal gland by the body's immune system. The reason why it is called an autoimmune disease. In an autoimmune disease, the body's immune system mistakes organ in the body. In this case, the adrenal gland is mistaken as a virus, bacteria, or a foreign invader and produce antibodies to attack and destruct it. About 70% of reported cases of Addison's disease are due to an autoimmune disorder. Other causes of primary adrenal insufficiency include tuberculosis, cancer cells spreading from other parts of the body to the adrenal glands, prolonged use of corticosteroids, bleeding and infection to the adrenal glands, and surgical removal of the adrenal glands. Secondary adrenal insufficiency is caused by lack of adrenocorticotropic hormones or ACTH made by the pituitary gland located in the brain. ACTH tells the adrenal gland when to produce its hormone. A lack of ACTH causes a drop in the adrenal gland's production of cortisol, but the aldosterone is not affected. A temporary form of secondary adrenal insufficiency occurs when people who have been using glucocorticoids hormone or corticosteroid such as prednisone for a long time to treat a certain inflammatory conditions such as asthma, rheumatoid arthritis, or ulcerative colitis, stops abruptly or interrupts taking the medication at once rather than tapering it off. This happens because corticosteroids block the release of ACTH. Common signs and symptoms include exhaustion, low blood sugar levels, nausea, diarrhea or vomiting, salt craving, weight loss, sores in the mouth, low blood pressure, muscle or joint pains, and a lot more. That's it for today's video. Thank you for watching.